Thank you, Mr. Speaker. Mr. Speaker, there has been much documented and published about the problems resulting from the Affordable Health Care Act. Millions of Americans are waking up to the cancellation of health insurance policies and that they've depended on to meet their families' needs at an affordable price. Skyrocketing premiums and deductible increases under the pressures of paying for coverage mandates that they do not want, they cannot afford, and even may have a moral objection to. Now, one area that has received little attention so far in this debate is what the impact will be on our hospitals, where much of the needed health care is provided by caring and competent professionals. Now, as a healthcare professional that served in rural hospitals for nearly 30 years as a therapist and a manager, I'm confident that the future of rural and underserved urban hospitals is not good under the pressures and the mandates of Obamacare. While some point to tens of millions of Americans who were uninsured now having some type of coverage, a plus for the bottom line of hospitals, I would encourage a closer and more thoughtful look. First, the CBO has estimated that even after full implementation, there will still be tens of millions of Americans uninsured. Based on the current reports from across America, this may include a lot of middle-class Americans who find themselves for the first time unable to afford what Obamacare has dictated. For a hospital, that assures the continuation of bad debt and charity care that hampers their balance sheets. For lower-income individuals under expanded medical assistance, it is true that hospitals will be paid, but they're going to be paid 40 to 60 cents for every dollar of care that they provide. Not exactly a sustainable margin, and more accurately, a pathway to bankruptcy for hospitals when coupled with the newfound population of uninsured. Mix this with the cost of compliance that will be rolling out from the Obama administration of the approximately 130 new regulatory agencies founded under the Obamacare legislation. Today, the cost of compliance with government mandates, including Medicare billing and HIPAA, just those two, account for a significant part of any hospital's overhead expenses. Multiply this by 100, under the yet-to-be-administered mandates and cost of care that will have a dramatic increase just to keep the doors open and the lights on for every hospital. The human resources cost of providing health care coverage for hospitals whose number one asset is a qualified and trained employee will increase as the Obamacare employer mandate is finally implemented just a year from now. Now, finally, consider the fees or taxes imposed on hospitals in 2014, just weeks away. Earlier this week, a hospital CEO from my congressional district reported that, quote, "We're going to have to pay close to $200,000 next year, as will every hospital," end quote. Hospitals will see other various fees, including a $5,000 levy, so the government can do research on the effectiveness of hospitals working within the plan. Additionally, hospitals will pay a $19,500 health insurance fee and a $160,000 transitional reinsurance fee that will go into the pot to protect insurance companies against the risk of winding up with numerous high-risk customers. These are added costs for the hospitals that Americans rely on for the access to health care. I have to wonder what now is so affordable about the Affordable Care Act. Bankrupt hospitals deserve no one. Americans deserve better. Thank you, Mr. Speaker, and I yield back the balance of my time.